I'm going to talk today about is graduation the end and how to stay involved in global health after medical school. So, I think everyone here is talking about chasing the dream, right? And as you know, we all get involved in global health somewhere. I imagine all of you being here have done some work in global health, be it typically what we all commonly think about is clinical work abroad. And so this is a picture from a medical mission in the Dominican Republic, which is something that a lot of people do. You go abroad for an elective, or you go abroad for 1 or 2 weeks, or you go abroad for even longer, and you provide clinical work and clinical care, right? These are things that we've all done in the past, right? So some of us have done policy, some of us might have done research, and others of us, as you can see, I've done teaching and talking, and we've all done some sort of global health. So the dream of being involved in global health as a physician starts easily from somewhere. And then what happens is you graduate, right? And that's me with my wife. And the first question I had after graduating is, well, now what? And now that you've become a medical student, you're staring down the barrel of residency. I will also mention this disclaimer that the photo is not from Matt's graduation. It was actually a couple of years ago after doing an MPH, which is something we will get to later on in the talk. But when we talk about now what, for those of you who are heading into it, you know the reality of residency is basically that you oftentimes are kind of stuck in a little bubble of residency, so it's tough to become aware of any opportunities in global health. You also have no time, no money, no support or mentors. Sometimes you have limited or no, I mean, I'm talking about myself here, right? This is where I started at PGY 1 year. And occasionally you have no reputational or institutional backing. And I think the last one is especially problematic for a lot of people who find themselves in residency who may have been used to say, oh, I'm going to pack up and skip off to some country and do work as a medical student because it's easy to skip a bunch of lectures that I'm not necessarily interested about. All of a sudden you're in residency and you've got requirements, you've got call, you've got all this other stuff, and you're kind of like my friend Henry here who's staring at a CT scanner and wondering why he's doing this. So, all these concerns aside, the beauty of residency is that it's a double-edged sword, okay? Yes, it's very true that you have less time and money than ever before, but at the same time, there are a lot of opportunities that come up with being a resident. I think residency is almost like a continuation of med school, but you have additional responsibility and credibility that allows you to experiment and forge some niches. For example, you can start to publish, you can start to speak, you can start to teach other residents, you can teach medical students, attending conferences, symposia, you can network all you want. Essentially, you can burn the candle from as many directions as you like. And the beauty of residency is that I kind of think of it in terms of like the businesses that start during a recession, right? If you start at university, you'll reap rewards in prosperity. So even though all your global health stuff may be kind of off the side of your desk and you're tired after having your post-call, you haven't slept in like hours or days or months, and what happens is you're basically working harder and harder than ever before without the money and the opportunities necessarily. Starting out when you're in residency and building something means that once you graduate and you start to have all that free time, you'll actually be adept at time management, at being efficient with what you need to do and prioritizing. So starting at university is like how businesses learn to be lean and mean during recessions and eventually prosper when times change. So let's talk a bit about opportunities then. And I'm sure, stop me if you guys have heard this one before, but I usually joke that the world is divided into two kinds of people, those that divide things by two and those that don't. So I'm one of the people that likes to divide things by two. If you're looking at opportunities, you have really two options. Find them or make them, right? You can just sort of sit there and do residency and nothing's going to really fall in your lap. So the case is essentially for you to find what you have, either pursuing and taking on what you've already gotten out of medical school, or you basically make as many opportunities as you possibly can in the global health field. And in terms of the making them, or even finding them, I should mention one thing is that this is a big fail. When I first moved to Vancouver, my wife and I actually didn't have proper sized envelopes, and we went to the nearby grocery store, which only had these like really small envelopes. So I thought, oh, whatever, it's smaller than a regular envelope, so I'll just stick it in the mail with a regular stamp and it should be fine. Of course, it didn't work out very well, and it came back returned to sender. But the big thing to remember is that setbacks can also be opportunities. And the beauty of this being an opportunity was that even though I had returned to sender, by the time it got returned back to me, my scanner had arrived. So I could actually scan it and send it immediately instead of sending it back out again. So in that sense, every time you try to find something, it's not working out well, or you're trying to make something that fails, that's always a learning experience and an opportunity to move forward. And at least you've made some connections or networks, or you put your name out there, that you're somewhere in the global health field a little closer than where you are. So let's go to the idea of these opportunities that I'm talking about. So as I mentioned, there's clinical work abroad, and in terms of that, there's short and long term. Long term is traditionally what a lot of people think about global health. I don't know if you've ever been to a lot of other global health panels, and this is what frustrated me throughout residency and medical school, is that you'll go to this global health panel and some doc who's like wizened and 70 years old will say, well, the way I got involved in global health was I basically sold everything and packed up my van and moved to Africa for 25 years. And then I became the expert on dracunculiasis in that one country. And then when the WHO needed to start a dracunculiasis eradication program, I was the man. And basically that was how I got involved in global health. So I don't know if that strategy works for any of you or any of us anymore, especially with debt and time commitments and all these other things. So it's good to start looking at other opportunities, which include obviously short-term clinical work, and there's research, teaching and education, both in a faculty setting in medical schools here in Canada, or helping to build local capacity abroad. And then of course there's policies, programs, and funding, which is like a big kind of nebulous category, which could encompass any number of organizations, nonprofits, foundations, you name it, right? And then there's also the question about working with disadvantaged communities in Canada and whether that constitutes global health, all right? So that's actually a very good segue for me to go into definitions, right? And there is no, specific definition of global health, right? I mean, how many of you have heard of Copland's definition of global health? The one where it's like, basically Copland says that it's not the issue, it's not where the issue exists, but it's rather the issue that makes it a global health issue. So things like lower socioeconomic status, Aboriginal health, that kind of things, those, according to Copland, can be considered global health definition. However, the purpose of my talk is that we know, for a lot of people who are interested in doing global health, going abroad and travel and seeing and experiencing other cultures is a main motivation for people. I mean, let's be honest, right? Travel is sexy, okay. Learning about other cultures is also sexy, right? And we all want to be more worldly. We live in this vast, interconnected world. All of us are on the internet, social media, you name it. We're meeting people everywhere in a world that is smaller than ever before. So the idea that you could possibly reach out across an ocean and touch someone or change something for someone is actually a very appealing prospect. In fact, when we talk about going abroad, the AAMC actually did a survey in 2011 of matriculating medical students that showed that 65% of them expected to go abroad at one point or another during their medical school career. So these are first-year med students, and going into medical school, they expected that almost 2/3 of them expected to be doing some sort of global health work abroad. Note that it does not say, I want to do global health stuff either at home or abroad. So that's just mostly a segue of a definition, because I'm sure the question always comes up, well, if you want to do global health, why can't you do it in Canada? Well, this is part of my talk is talking a bit, focusing more on the abroad piece as opposed to working locally in Canada. So, let's talk about clinical work abroad, right? You have a few options. You can build it into your residency program, right? And I mean, this one's the most obvious one. You use elective time, right? So if you're interested in going abroad, you say, all right, you do what I did in first year. I was just like, I'm going to go to China for 5 weeks, and I'm going to go do a research project, right? The question is this the best value of your sparse elective time? If you are trying to become a stronger, better physician, is going abroad to do a research elective the best use of your elective time when you could be boning up on skills, in some other form or another, right? That's one thing. Then the other part is you could build it in your vacation time, right? So this is your short-term medical experience opportunity that I talked about. That comes with all its harms and benefits, right? Like the question of going abroad, you gain a lot, and the organization that sends you gains a lot, but what are you really doing for the community abroad? And also, that also begs the question of whether this is the best value of your sparse vacation time as well, right? Because, hey, I mean, all of us work hard, all of us do a lot of a lot of long hours in the hospital, and do you really want to be going on vacation and continuing to do clinical medicine? So you've got the elective, you've got the vacation time, then I call the third opportunity, you can pull a Paul Farmer, right? So I don't know if any of you have read the book Mountains Beyond Mountains, but essentially Paul Farmer started out by reorganizing call schedules, heading down like every weekend he possibly could from Boston to Haiti, right? That was his whole thing, and he had this single goal to make Zanmi La Santé, which is his organization that eventually became Partners in Health. He was focused and single-minded in his purpose in making that work and providing a preferential option for healthcare for the poor. So he started by essentially doing primary care clinics in Haiti, like as many weekends as he possibly could. This is also essentially, like I said, flying down on weekends, reorganizing call schedules, also known as what I call the by any means necessary approach. So basically, if you're willing to do it, if you're willing to try it, say, screw residency, I'm going to just go for it and do this over weekend. Some people have done it. So in terms of pursuing clinical work abroad, though, those are probably your three best options as a resident physician. Now, this also gives me the opportunity to talk a little bit about sustained versus one-time work. And so being, as I mentioned, as Liz mentioned, I'm part of the 53rd Week, which is an organization that aims to reduce the harms of short-term medical experiences abroad. What this means is that a lot of people will go abroad on like 1 or 2 week missions. They'll go down, they'll hand out pills, and they'll come back and feel good about themselves. Yay, mama, save the world. But the question is, what are you actually doing when you go to those communities and you just provide downstream primary care over a week, right? Essentially, if you're doing that just once, you have incredibly limited impact on the community that you're purporting to help. That said, obviously it's good for your own exposure. You see disease patterns that you wouldn't see here in Canada, and you have an opportunity to basically develop your own skills. So it's good for you, it's good for the organization that sends you, but it's kind of questionable for the community in question. So then that becomes the question of, if you're going to continue going and you're going to have a sustained outcome, that means that clinical very much becomes only a small part of what you should be doing. If you're going down to a community for the 7th vacation in a row and you're still doing the same thing and you're not really making an impact, I think it's important to really take a step back and wonder what you're doing and what you're trying to accomplish by going down there. And as I mentioned, long-term, shorter. If you're doing short-term over the long-term, it can essentially be harmful or close to useless if all you're doing is just going down and providing a handout. And so the question is, you need to really start looking at other opportunities in sort of sustained efforts to think about making a meaningful impact. This is assuming you want impact, right? If you don't want impact, you can just travel instead, is what I'm saying. Like, sometimes it's better to just travel as a tourist and go there and hang out for a week than to go there and actually hand out pills and whatnot. So these are all things that we can talk about in questions, but I will pop on to some of the other opportunities. That's the clinical one.